Welcome to Kitchen Table Conversations, a series of short and shareable conversation starters for those of us who have or love and support people with a complicated and beautiful brain. Here's your host, Angela Geddes.
Hi, everyone, and welcome to another edition of Kitchen Table Conversations. I'm your host, Angela, and thanks so much again for tuning in today. There's been a lot going on in our world over here in St. Thomas, Ontario, and across the province with regards to our private practice and our social work assessment and support services. We are seeing on a daily basis that the need for such specialized services is very great. And, we're just once again so honored to be a part of so many people's lives on such intimate levels, really, that to get the trust that we get from individuals and families is quite an honor, and we don't take that very lightly. And part of our role includes offering what we've learned across the years of our experiences through training and education opportunities, and also it involves us continuously learning. Last week, we were very fortunate to be able to attend a conference that was specific to fetal alcohol spectrum disorder, and it was offered through Wellington, Dufferin, and Guelph Children's Services. I know I didn't get that name right, but they do have a collaborative approach to mental health, child protection, and developmental services, which I think is amazing. And so they put on this beautiful conference, and we were just wowed with the expertise in the room. And as always, it's just so great to hang out with like-minded people to kind of validate the fact that we're doing the right thing and that we're further inspired and educated so that we can continue to provide the best services possible. Knowing once again that we don't have all the answers, but we're certainly open to finding them together. So the keynote speaker of this conference was Shannon Butt, who happens to be a peer support worker with our organization as well on a part-time contract basis. She was utterly amazing, helping us all to understand, what the complicated mental health and developmental presentations, how that impacts her day-to-day, and what some of the things that have occurred in her life over the years that have been really helpful. And we also talked about some things that were maybe not so helpful. But the takeaways from her perspective that left us all very hopeful and inspired were her reliance or her appreciation for meditations. And she gave us an example of Insight Timer that provides like many, many, many free opportunities for us to dip our toes into that area if we're interested. She spoke very highly of acceptance commitment therapy and how that has helped her and her family embrace and accept and understand the complexities that come with complex neurodevelopmental disorders. And she spoke, again, favorably about how the acceptance commitment therapy itself and the training helps people to struggle less with things that have historically caused a lot of pain. And it allows people to be less reactive, as does restorative yoga, and just really slowing down our nervous system. So I also attended a conference that day by an occupational therapist. Her name was Sarah Brown, and boy, oh boy, she was just amazing as well. And in my practice, I see on a regular basis where people take in a lot of information in very busy brains to begin with. We work a lot with people who have anxiety. We work a lot with people who have attention difficulties, some with a diagnosis of ADHD, some with a diagnosis of autism spectrum disorder, and certainly some with fetal alcohol spectrum disorder. And for a variety of different reasons, there are a lot of times where we are supporting kids with sensory overload. So I think most of us are aware of the five senses. So when we talk about grounding exercises and ways to kind of calm down and regulate, I often encourage people to take a moment to engage the five senses. And so sometimes I'll suggest, take a look around the room, and maybe we can do this right now, actually. If you're feeling a little bit anxious or a little bit overwhelmed or just kind of busy in your body and your brain, We often encourage people to kind of look around the room and notice your breathing while you're doing it, and find and name 5 things that you see. And then we will follow that up with maybe 4 things that you hear. So just taking the time to notice 4 things that you hear and name them. Maybe then we can follow that up with 3 things that you can touch. Sometimes I flip those because it is easier to find things to touch than it is to hear sometimes. So by the time we take the time to touch and actually name them, that helps to sort of slow ourselves down a little bit. Then we can move on to 2 things that we can smell, potentially, and then we can move on to 1 thing that we can taste. And sometimes that's just the taste of our toothpaste, or maybe we've got gum in our mouth, or sometimes we can imagine a taste if we picture a lemon, for example. So those are the main 5 senses that I think most of us are aware of. But when we talk about sensory processing difficulties, which so many of our littles and our big people experience challenges with, for example, bright lights. I know bright lights really bother me. I often will end up with a headache, and I just feel really tired when I've got those big lights on. Lots of noise, and some of us are really sensitive to some of those, kind of more subtle noises, but they can be quite distracting to people, like, kids in class that are tapping on the table, for example. Just a light little tap could be all-consuming for somebody across the room. And sometimes people are oversensitive to smelling. So I remember one time working with a person who their school was very close to a bakery. So around 2:00 in the afternoon, we lost this person because he was just overwhelmed with the beautiful smell of the 2:00 bake or whatever it was at that time. But the windows were often open, and that smell came made its way into the classroom, and it didn't seem to impact anyone else except this one little person. So everybody's sensory input is different, and what we can handle is very different. But again, one of the things that I see on a regular basis is that sensory overload can manifest itself into fairly puzzling and difficult behaviors. And so being aware of our 5 senses, but now we're learning more about 8 different senses. So we do have 8 senses in total, I suppose, and the 6th sense is focused on balance, and that these receptors are in our inner ear, and stimulation occurs through any kind of change in position or any sort of movement of the head. So that kind of affects coordination and just a sense of balance and that kind of thing. And the 7th sense involves how we interpret movement. So the system is within our muscles, our tendons, our ligaments, our joints, and all of those have receptors that tell our body, what space we're sharing, how we move around, and how we interpret that kind of thing as well. It can also help us to feel stable and grounded and know where we're going and what we're doing. And then the final 8th sense that is becoming a little bit more talked about these days is called interoceptive input. So those are your internal feelings. And so I think that, I experience this a lot, and I have for many, many years. I used to work in a transition classroom or a section 23 or 25 classroom. I can't remember what it was called now. I know they've changed a few names over the years, but the classroom was a specialized classroom with very small numbers and, aimed to reduce the stimuli and to be able to help with focus and concentration and real goal setting, and really making some necessary accommodations so that the students would experience more academic and social successes. So this was a mental health program where the families were involved as well. And many of the students that were there had, as I said, difficult time with the lighting, difficult time with the sounds. Sometimes, we have people who benefit from noise canceling headphones, but also I came across a really high kind of relational number of students who had trouble with their internal systems, and sometimes would be really late in terms of training to use the washroom independently and successfully. I just really learned really early on that many kids don't seem to feel the urge or the need to use the washroom until maybe it's at the very end, and then they're in kind of an urgent situation. So people who are late to train often have some sort of interruption, and this is often developmental in nature. So again, I want to focus on interoception, which is the sense that allows us to notice some of those things that are going on inside of our bodies. And sometimes as simple as like a growling stomach or when our heart starts to race. Sometimes we have physiological responses that we're not aware of on a conscious level. And so this is a really big deal because sometimes our physiological response gets a bit confused. So we can, for example, associate a raised heart rate because of exercise with something that has happened to us in the past that was actually very scary or traumatic that raised our heart rate. And so sometimes we have to take a little bit of time and effort and support and awareness to be able to reconcile that those are different reasons for our hearts to be racing, for example, or those are different reasons for our stomachs to be a little bit uncomfortable or nauseous. So this whole interoception thing is really something that fascinates me. And again, Sarah Brown, who's the occupational therapist, referenced the work of Kelly Mahler. And so I know I have done some research. I've attended some sessions on this, but I'm really curious to learn more and more and more. But some of the differences that I'm seeing again are recognizing a lot of kids. And I surprised a parent the other day by saying that it's really common for kids to not recognize when they're hungry, full, or thirsty, especially those who have been impacted by prenatal alcohol exposure. And again, that's not the only reason for these experiences, but this is something that I see a lot in my practice. Again, late toilet training definitely happens. Identifying when they're sleepy is something that's really, really common. Overly sensitive and not sensitive enough to pain. I've had kids walk home with a broken ankle and not know that it was broken. I've had kids walk out in the wintertime without a coat and not feel the discomfort of the cold until they come inside and are recovering from literal frostbite. So that's when the intensity of the pain actually kind of kicks in. I've had other people that are very, very sensitive to pain or discomfort to the point where brushing their teeth is uncomfortable. Tags on the back of their shirts are really uncomfortable. Socks can be unbearable for some people. And then we've had a lot of people that really had difficult time kind of pinpointing what was really going on for them. They just knew they didn't feel well, but what didn't feel well specifically was really, really hard. And I've had people try to explain this to physicians and kind of be dismissed and just told to leave the room, because if you can't tell me what your symptoms are, you're obviously not suffering that badly. So lots and lots and lots of misunderstanding and lots and lots and lots of work that we all can do, I think, to understand this eighth sense a little more comprehensively. So people who struggle with this interoception also commonly struggle with identifying what kinds of feelings other people are experiencing. So really sometimes can have a difficult time understanding some of those social cues and reading a room sort of thing. And they can equally be challenged with understanding what their own big feelings are. And being able to identify what's happening with their body and with their mind and with their heart, what's going on for them in order to sort of mitigate a potential meltdown or a blow up. And then, I was just at an IEP meeting earlier today where the goal was for the individual to be able to identify when they needed a break and to take one. And my experience is that people who struggle with this sort of interoception don't have the ability to see when they need to utilize some of the coping strategies that they're aware of in order to follow the rules and the social norms, again, that they are very much aware of. But the inability to follow through with some of these things requires a different, more creative approach, and certainly some people around them to help with that co-regulation. So I encourage you to, do a little bit of a Google search potentially. I will put some links on my website that can help lead us to more information around this interoception and sensory processing difficulties that we often see in some of our young people. So again, I attended another conference. I'm just always very hungry to learn as much as I possibly can to bring it back to our practice and to make sure that we're helping individuals and families to live their best life. So we talk about this kind of thing often in our practice. And again, I think many of you might know that I'm also a yoga teacher, and I always kind of qualify that by saying that I'm not necessarily a very good one, but I do incorporate yoga on a daily basis and certainly within my practice for those who are interested, and really trying to connect that body, mind, heart, and soul so that we can read ourselves better and know what we need and be better positioned to ask for the kinds of supports that we also need from time to time. Once again, thanks so much for tuning in to this Kitchen Table Conversations, and I hope that you will bring it back to yours. With many thanks, Angela.